Good morning, everybody. So I'm Alvin, and I'm the pre-public health director. Just want to thank you again for coming. And will be our second admissions panel. So the whole process of this is we're going to just go down the line, have our attendees or speakers introduce themselves, and then we'll follow that up with some questions and answers. So we'll start with Durrain here.
Okay. Hi, everybody. My name is Durrain. I work as the Diversity Outreach Coordinator at the UC Berkeley School of Public Health. Thank you for being here.
Hi, good morning. My name is Gayle Cummings. I am from Toro University. I serve as the Interim Program Director for the Public Health Program at Toro University, California in Vallejo.
Alvin, I just wanted to process check the last group. They all talked about their program. Should we just introduce ourselves and head back to the start so we each get to talk about our program a little bit?
Yeah, sure, if you'd like to do that.
Maybe we should just do that?
Yeah, sure.
Yeah?
Okay, so I'm Sally Geisse, and I'm the co-graduate coordinator at San Francisco State University, and we have an M.P.H program in community health education.
Good morning, everybody. Greetings from, as they say in Boston. How are you guys today? My name is Emily Kiley. I am the Director of Admissions for Tufts University School of Medicine's Public Health and Professional Degree Programs. It's a mouthful. So welcome. Happy to have you in the room today. Looking forward to sharing more about Tufts and public health with you all.
Good morning, everyone. I'm Zach Maggio. I'm the Director of Admissions and Enrollment at New York University's Global Institute of Public Health. Welcome.
Hello, my name is Betsey Asher, and I'm here representing Columbia University's Mailman School of Public Health. Thanks for coming.
Great. So I guess I'll talk a little bit about my school that I represent, UC Berkeley. So UC Berkeley offers a variety of M.P.H programs, so that's a Master of Public Health, as well as doctoral level PhD programs and DRPH programs. And we also offer academic degrees, so that's your Masters of Science and your Masters of Arts. There are a lot of different concentrations. We offer degrees in the 5 core public health concentrations, so that's environmental health science, health policy and management, epidemiology, biostats, and then our community health equivalent is called health and social behavior. A couple of things that kind of set UC Berkeley apart: we have a really strong commitment to social justice. So for those of you who are maybe interested in working with underserved communities, really looking at health disparities or health inequities, I would say that UC Berkeley makes that a focus of the research that they conduct, the faculties who are doing that research, the students who are at the school usually are involved in some kind of health disparities work, either through their internships or their research. The extracurriculars that the students participate in are also often focused around social justice issues. So that was a big draw for me, why I went there. Another quick thing about UC Berkeley is that we have really good internship placement support. I'm sure for those of you who have researched, you realize that during your M.P.H, most schools do require you to do some kind of field placement or internship either during the school year or in the summer between your first and second year. And UC Berkeley has a really great career center that's just for the Graduate School of Public Health. And we do internship placement, everything from interviews, writing cover letters, resumes, negotiating salary. So for those of you who want to get a job after you do your degree in public health, we're there to help you do that.
Thank you. Again, I'm from Toro University, California. We have had our program in public health since 2007. So one of the differences you'll pick up on, I'm sure, throughout the day is there are schools of public health and there are programs in public health. We are a program of public health, which means we're more of a generalist M.P.H program. We do have 2 specializations. You do the core public health courses, as Durrain talked about, but then you specialize, and we have 2 specializations, one in the community health track and one in the global health track. And obviously, there are 2 obvious differences between the 2 with the track courses that you take in those specializations, in addition to your field work. So for those folks who specialize in the community health track, your field work and your culminating experience, meaning your capstone, would focus on something in the domestic United States, issues related to the U.S. With a global health specialization, obviously, your field work would be in one of our 3 countries where we have current institutional agreements, and those 3 countries are Cambodia, Ethiopia, and Bolivia. We have students that go abroad for between 6 weeks and 10 weeks, depending on whether or not they're independent M.P.H students, which about 50% of our students are, or whether they are in the dual degree tracks. We have a very unique population of dual degree students where half of our students are actually either DO M.P.H students or PharmD M.P.H students, and we have another specialized track with our joint PA M.P.H program, and we are actually the only institution that mandates that our PA students actually also do the M.P.H degree together. So I think that's kind of the one thing that kind of sets us apart.
Hello again. Just to put some context on San Francisco State, in addition to our M.P.H program, for which I'm the admissions chair, we also have an accredited undergraduate health education major. So that, in a sense, increases the number of faculty accessible to the M.P.H students as well, because we're all one big happy family in our Department of Health Education. In addition, because I know there's quite a few of you who might be interested in medical school and that avenue, there's also a post-bac program at San Francisco State, a pre-med post-bac program offered through the College of Extended Learning, which also collaborates with our Department of Health Education to provide sort of a public health lens for the pre-med students. Okay, so then about our program. As my colleague mentioned, there are programs and schools of public health. So Berkeley is a school and Touro is a program. We're also a program of public health, and our specialty is community health education. And what is particularly attractive for the students who find our program a fit for them is we're incredibly intimate. So we have about 45 to 50 students in our program at any one time. And in addition to that, it's a cohorted learning community. So a group of 20 to 25 students comes in together and is chosen by the admissions committee, a process that I direct, which is a combination of faculty and students on that committee. So we're very big into student governance. And we select that to be an incredibly diverse learning community in every sense of the word, not just in demographics, but also in areas of the field in which people have their experience, passions, and career interests. So it enriches the experience of learning together as a cohorted community. And those students, the ones on our 5-semester plan, which is the minimum number of semesters to complete our program, that's 2 years. It includes a summer between the first and the second years. They complete almost every single class except for their elective class together as sort of one big happy family. Or one sometimes an unhappy family. You know how families are. But what you get out of that is depth in terms of networking, community building, not just among your peers as students, but also with the faculty. The faculty is incredibly accessible and are very invested in deep, long-term mentoring for our students and our alumni. And that's an interest that I've taken in my work. As a part of my work is bringing our alumni closer in. And so online is a great way to do that. So I have Google groups that I run for students and alumni, and I have over 200 people on them now, and from a small group that's pretty good. And I send out professional development opportunities and job opportunities anywhere from 3 to 10 a week. We also have events. We have a very active graduate student organization. I'm also the faculty advisor for that, and they're very much focused on the professional development of our students, alumni, and wider community, and they have a career development seminar every year, as well as other community building and professional development events. So the idea is it's a small program, but in a sense that almost enhances the networking and educational opportunities for the students who find themselves a fit. And I get that I'm kind of blah-blahing, so I'm going to kind of curtail it a little bit because I'll be at the fair. And so if anybody of you are interested in our program, you can come and talk to me more in depth about it. But I did just want to say a couple more key things before I pass on the mic. And that is our social justice lens. So we have a social justice health equity lens, which influences, if any of you were here for the keynote speaker, Dr. Solomon, who was talking about upstream factors. So even though we, of course, train and both knowledge and skills in upstream and downstream factors. We have a special focus on upstream factors. So we're imparting skills and discussing aspects of tools to affect social change, such as community organizing, community engaged research, collaborations across disciplines, cultural humility, policy advocacy. So these are all things that are really, really central to our mission of social justice and health equity. Okay, so now for the little nitty-gritty. One other aspect is our team practice experience, which is 2 semesters and supervised, which is a bit unusual. So it's not just you would go out and do an intern, you're working with the class on a class community assessment project over a 2-semester period, and you're working with actual community partner to affect social change in the field. So our last 2 classes, for example, worked with Hope SF, which is a large-scale public housing revitalization project in San Francisco. And the first group of students worked in peer leadership strategies. The second group of students worked in mental health of children and families within the residential communities. And their work has, to date, resulted in over $3.5 million of grants. Not just the students' work, but the students' work being a component in the collaboration that has secured those grants to promote revitalization in these communities. Real quick nitty-gritty about admissions. We do require, because we integrate in theory, practice, and research, and but we are interested in the diversity in the working professionals, so we require 4,000 hours of work. It can be part-time, unpaid, or full-time. And that also enriches because then you bring your work to the classroom and you take from the classroom back to work, although some of our students choose not to work while they're in the programs. But all of them have had experience, health-related work experience before they come and start our program. In addition, we require the GRE, a 3.0 or higher GPA. We are not on SOFAS, but our application instructions and materials can be found on our website. And now I'm going to zip it.
Great. Again, my name's M.Sc. I'm the Director of Admissions for Tufts University's Public Health and Professional Degree Programs. I am here from Boston, Massachusetts, and more specifically, Tufts has 3 campuses, and I am from the Health Sciences campus. So there we have dental, obviously medical, we have a nutrition school, and we are kind of located in Chinatown. So we have a lot of great restaurants right around us. So, although I don't tend to leave the office too much, unfortunately. So I wanted to talk to you a little bit more about public health and professional degree programs, which we affectionately refer to as PHPD. It is such an interesting group of programs. So just to give you a little bit more of a sense, it houses the master's programs within the School of Medicine. So I have my public health programs, which of course includes a Master of Public Health, and I'm going to talk a little bit more about that, but we also have a Master of Science in Health Communication, which is interesting because it is housed within a School of Medicine. And then I also have a Master of Science in Pain Research, Education, and Policy. And then we have our professional degree programs. We have a Master in Biomedical Sciences, which is a special master's program. Some of you may be familiar with those. And we just added a, this is a mouthful, Master of Science in Development and Regulation of Medicines and Devices. And then we also have a new program, a physician assistant program, and we are about to enroll our second group this coming January. So we have a lot going on in PHPD, which I think creates for a lot of the richness within there that our students are able to experience. With the public health program, the M.P.H specifically, we do have a lot of combined degrees, which I'm always fascinated by reading the applications because there are so many different areas from which you can enter public health. So for instance, we have a JD M.P.H with Northeastern University. We have an MD M.P.H with the medical school. We have a DVM M.P.H with our veterinary school. We have a DMD M.P.H with our dental school. So I like to think we pretty much have a dual degree with every single school at Tufts University. So as I mentioned, we have 2 other campuses. We have one in Medford, Massachusetts, which is about 6 miles north of Boston. And then we have Grafton, which is an hour west, and that is where the veterinary school is. So we, again, have a really a great set, a lot of different things going on, and and a lot of that comes together in the classroom. Similarly, for the M.P.H program, similarly to some of our other friends here on the panel, we have some concentrations. We have EpiBio, Global Health, Health Communication, Health Services Management and Policy, and Nutrition. We also have a generalist track for students who may have another master's degree or who may already be a doctor and are coming back for an M.P.H. And then some of our dual degrees, for instance, like the MD M.P.H, is a generalist track that can actually be done in 4 years. Happy to talk to you all more back at the table because there's so many nuances to each of our programs, and I've been there almost 6 years and I'm still learning all of them. So we have, because we are a program and not a school, we have a smaller size population of students. So just speaking specifically to the M.P.H, for instance, we enroll each fall about 30 students in that program, and the majority of them are full-time. Many of them are working. So we have classes that actually convene in the evening, which make that a little bit more possible for students. It's not a bad thing or a good thing that you go part-time or full-time. It's just what works for you, and I think that's what we're all about, is making it work for your schedules. We, in the second year of the M.P.H, again, depending on which degree you're doing, if you're not doing the combined degree, for the pure M.P.H, as we call it, you have an applied learning experience, again, the field experience that you've heard referred to on the panel. And that is doing a public health project in a public health agency. And in the end, you present on that to your peers and the faculty, and you also have a paper on that. So it's sort of like an internship, and it's sort of like a thesis, but not quite entirely. We have students doing those all over the place, again, depending on the concentration that you choose. I'll pick global health as an example. A lot of our students do like to obviously go overseas. We have some relationships in Vellore, India, Ghana, Panama. So we have many places that you can go domestically and internationally, and then you would have a preceptor at those sites to assist you in your efforts through your project. As we consider you for admission to the M.P.H program, we don't actually require that you have a certain length of work experience. We are basing it on the quality of the experience that you have to date. So all of our students really are submitting resumes with their applications at this point, and we're able to deem, what you have done and make sure that you actually know what public health is and that you have a little bit of experience in that area. Of course, we're also looking at all of the other juicy stuff like GPA and test scores. Our GPA on average is about a 3.1. We do require a test, but since we have so many different combined degrees and a lot of people coming from different backgrounds, we do look sometimes at different tests. So certainly the GRE is the one that we see most often. But from our JD M.P.H students, for instance, we're going to accept the LSAT, the law exam. Right now, because we are a program, we are using our own online application. It's through a company called Embark. But recently, and I'm still kind of learning about this, the American Schools of Public Health has kind of reorganized themselves to accept the programs into their organization, as well as the schools, and I can't remember the new name of it, but
It added a P.
it's
Yeah,
PPH.
one more P.
Okay. More P. So, more Ps. So we will, I think, for the coming cycle for next year, probably be on SOFIS because we have joined that organization. We are also looking at 3 recommendations for you during the application process as well. We have fall entry, spring entry, and we do have some merit aid available for students, although I always encourage you to just get out there and keep looking for outside scholarships beyond what each university offers, because at the graduate level, you're going to find that I think, maybe not in all instances, but in some, there might be less money and it might be a little bit harder to find. So I sometimes recommend going old school and talking to your maybe even local librarian about what resources he or she might hear are working well for students. What else? We have a wonderful faculty. They are very present and available to our students. You would have them as advisors. I would encourage you to check out our website to see what research they're doing and where their areas of expertise lie. We actually have a faculty member right now who's our kind of environmental expert. She's actually sitting on the chemical safety board at the White House right now. although I think she's on furlough, so unfortunately. But anyway, we do have faculty in wonderful areas, and you're able to learn from them. And we too have a great career services office. They have a lot of resources available to you. Again, happy to speak with you more out at the fair, but I want to keep passing it along.
Hello, everyone. Again, I'm Zach Maggio, and I'm the Director of Admissions and Enrollment for New York University's Global Institute of Public Health. Everyone else so far has spoken from notes. I have no notes, so there's a real possibility here. I'm just going to talk myself into the weeds, but I'm going to give it a try and see how this goes. I think we all have great programs. I mean, that's clear, so I just want to say my program is great in all the ways theirs are great, too. No. If I had to describe to people what I think is different about how we structure public health at NYU, the first thing I would say is that at NYU we have this thing called the Global Institute of Public Health. So we don't have a school of public health, we have this institute instead. And what it is a collaborative, multidisciplinary entity. So it actually involves the participation of a number of NYU schools and colleges. And we don't have a school by design because the leadership at NYU, when they decided to identify global and public health as an academic priority for the entire institution, it was decided that public health would be structured in a way that mirrored the discipline, which is multidisciplinary. So I think that makes a qualitative difference in the experience our students have, because as a student in one of our programs at NYU, you will actually be taught by faculty from the schools of medicine, dentistry, nursing, social work, public policy, and education. So each of these, disciplines brings a different pedagogical approach and a different perspective, and we think it's important to expose students to that, and we think it makes a real difference in the kind of educational experience they have. At NYU, we offer 10 undergraduate global public health majors, each of which actually pairs public health with another discipline. So as an undergraduate, you can't just study public health at NYU. You can study global public health / anthropology, global public health / food studies, and so on. And there are 10 of those majors. We offer the M.P.H degree with 3 concentrations. The 3 concentrations are community and international health, that's one of them, global health leadership, and public health nutrition. And I think you'll find that we're one of the few programs in the country that actually offer a concentration in nutrition. We also offer a brand new PhD in public health. And thinking about our perspective at NYU, I would say we're very practically focused. We're very invested in giving students practical hands-on skills and opportunities to synthesize what they're learning in the classroom, to get bona fide experience on their CV by the time they graduate so they can hit the ground running, get a job, to make the kinds of professional networking and associations that they'll need to have when they graduate so that they've already have a kind of professional network by the time they're entering the public health workforce. We are a relatively modestly sized program, not as small as some of our intimate colleagues over here, but about 250 students total, and we're very well staffed for that size. And part of that staff are public health practice staff, who all they do essentially is work on professional development and career opportunities for our students. So we do a lot of seminars and workshops on things like writing your resume for public health, networking in public health, those kinds of things to help you identify what kinds of organizations have the kinds of opportunities you're interested in and how you can approach them. We have public health career fairs every year. We have networking events. We have job talks in which employers come and visit with our students. And we think all of that is really important because this is a huge investment of your time and a huge investment of your money. And I think if you want to think crassly about graduate education nowadays, you could look at it as this hugely expensive product you're investing in. And I think one of the things you are buying when you buy that product is you are buying the network of relationships and opportunities an institution is able to provide you with. And New York University is a world-class research institution in a world-class city, and the sheer density of organizations and opportunities in a place like New York City, I think, make it a really unparalleled place to study public health. And all of the biggest names come through a place like NYU. Since I've started working at NYU, I've met Bill Clinton, Gordon Brown, Ban Ki-moon. I mean, one of the benefits of being at a place like NYU is that all of the major players in public, not just public health, but all of the other disciplines that play a contributing role are going to make their presence, they're going to make themselves available at some point. And I think that can be a real selling point. Because when you're out there looking for a job, The extent to which you've been exposed to players from these organizations like the UN and the WHO and the major NGOs, all of whom either are headquartered in New York City, have a major field office there, will make a real difference. In terms of admissions to our program, I would say we're holistic and we're fairly liberal in the sense that a lot of people ask me about what kind of student are you looking for, what's the profile? Well, I don't have a profile. We value a wide range of backgrounds and experiences, and every year we admit students from liberal arts backgrounds who didn't study something related to public health as undergraduates, but are able to articulate a meaningful reason why they want to study at NYU, and that's what we're looking for. We're looking for two things. One is evidence that you're going to be able to succeed in graduate level coursework because we don't want to set anyone up for failure, and two is this ability to articulate why this is a good fit for you. Those are the two key elements of the application, and you can, I think, tell just by that description that there is no one part of your application that's really going to make or break it. So I don't discard applications if the GPA is below a certain level. I don't discard them if the GRE is low. We're looking at the whole picture of what you've done in the context of the experiences and opportunities you've had available to you. We're very open to the idea of people either changing careers. We're very open to the idea that people studied one thing but came to the conclusion later that public health was really the right field for them. So we're very open-minded in this admissions process. It's not a way to keep people out, it's a way to bring people in. That's the way we like to think about it. And I'll be at the fair, and I'm happy to talk to any of you about what we do at NYU and about your own academic and professional goals, and I look forward to that.
Thank you. Again, I'm Betsey. I'm here representing Columbia University's Mailman School of Public Health. We're also located in New York City, way uptown in northern Manhattan. We're part of our medical center campus. We're right next door to the New York Presbyterian Hospital, as well as our medical, nursing, and dental schools. We offer 3 different master's programs and 2 doctoral programs. We have 6 academic departments, and not all of the departments offer all of those degrees. That being said, everything that any of us say, you should be looking at our websites for all the details. We have a student population of about 1,300 across all of the degree programs. 80% of those students are Master of Public Health students. We've been around for a while, since 1921, and we're an accredited school of public health. 2 years ago, we revamped our M.P.H curriculum. Seeing the changes that were happening in the field of public health, we felt that we had to make some changes in terms of how we teach our students. With the new curriculum in the 2-year program, well, whether you're in a 1-year or 2-year M.P.H program, you will complete an integrated core of public health courses. We've also introduced a couple of professional development components to the core. One is called the integration of science and practice. It's a bunch of case-based learning, so you're not just sitting in a lecture hall getting lectured at, but working on real public health problems with a cohort of students. The second is called Leadership and Innovation. It's all about helping you to learn how to work on teams, because public health is very collaborative in nature. Learning when to step forward and when to step back, how to recognize people's strengths and weaknesses on your team, and hopefully being able to come up with resolutions and solutions to public health problems in a respectful and productive way. Within the 2-year M.P.H program, we've also included a certificate in your studies, so students will graduate with both an M.P.H and certification in a specialty area. And there are 23 different certificates that you can choose from, and your certificate is meant to complement what you're doing in your discipline. The difference between the 2-year M.P.H and the 1-year M.P.H, the 1-year accelerated program requires that you already have a doctoral level degree, be in the process of getting a doctoral level degree, or you need a master's degree and at least 5 years of relevant work experience. So obviously those folks are pretty well advanced professionally and academically. The 2-year program accepts students straight out of undergraduate for the most part, or with a little bit of work experience. Some of the certificates have a work experience requirement, so again, you need to look at the website to be sure you understand who requires what, which programs require what. What else can I say? We're offering an MHA program starting in 2014. This is brand new. All the literature that I have over at the fair doesn't have anything to say about the MHA. That's how new it is, but it is on the website. So if you're interested in a Master of Healthcare Administration, we now have that. We have MS programs in biostatistics, epidemiology, sociomedical sciences, and our doctoral programs. In almost every department, we have a PhD and a DRPH, but some exceptions there. I think we attract a very diverse student body. Public health is a very broad field, and it takes lots of different kinds of people to do public health work. So you shouldn't think that you have to be a science major or pre-med to do public health. I have an interesting example of a graduate of our program who came in as an English literature major in undergraduate. She did our Master of Public Health degree, and she became a speechwriter for the Surgeon General. So there are lots of ways that you can incorporate undergraduate studies into public health. It doesn't have to be hard science necessarily. I think when you're looking to apply, I would reiterate what all of my fellow panelists have said. It really is a lot about the focus and knowing enough about public health and enough about yourself to knowledgeably choose the area that you want to study. This is a graduate program. It's going to give you specific skills and training to help you achieve specific career goals. So if you're feeling like you're sitting on the fence about any of this, then maybe it's not the right time to apply. Maybe you need to go out and gain a little more experience or perhaps take some extra coursework so that when you do apply, it's obvious to us that you're ready and able to tackle the program. That being said, work experience for the Columbia School of Public Health is sometimes required, but always encouraged, because we think that that's part of what helps you find that focus. In terms of admissions, we work with SOFAS, the Common Application. Our application deadline, we have a preferred deadline of December 1 and a final deadline of January 15th. And those dates hold true for most of our programs, but there are a few exceptions. So again, you want to check the website. We do a very holistic review of the application. Unlike applications to other graduate professional schools, our applicant pool is still small enough that we can manage it. As long as your application is complete, we'll look at it. We don't set cutoffs. We don't need to weed people out with a low test score because the applicant pool is just unmanageable. We'll look at everyone's file as long as it's complete. In terms of financial aid, we do have institutional funding, but it is limited at the master's level. So it's very important to apply early, because once those funds have been allocated, that's it. And the application to financial aid begins with your application to the program. And again, in that regard, it's important to meet the December 1 deadline as opposed to waiting around to the January 15th deadline. And I think I'll stop here. I'll be over at the fair later, so I'm happy to speak with people about the programs and all in more detail at that time.
All right, so our first question is aimed at Mrs. Cummings, and our other panelists can answer afterwards. So our first question is, it is said that volunteer experience is suggested, but have you ever admitted anyone without any volunteer work?
I guess sort of similar to what some of the other panelists have said, volunteer work is obviously something that's encouraged. It's not required. A number of our students, we have a diverse variety of students that actually are enrolled in our program, admitted into the program. Many students do come with work experience. We are an evening program as well, so we have a number of folks who have worked in the field for years and are coming back just to get that graduate degree. But we have a number of students also that enter our program directly from undergraduate, their undergraduate experiences. Many of them have some volunteer work, so we do have a variety of students, some without experience, some with experience, but volunteer experience is encouraged, strongly encouraged. Does that answer your question?
Yes. Would anybody else like to add more to that?
I agree.
Okay, so our second question is, this is for the whole panel. What are some challenges facing public health today, and how does your institution help prepare students to address these challenges?
I think the keynote speaker kind of, covered a lot of that, and that upstream, downstream stuff. And I think for Columbia, again, revamping our curriculum has made a big difference. You have to take into consideration these cross-cutting competencies that are so important now, and integrating other aspects of our health as a whole. And I think, how you decide to define that word health kind of influences these these cross-cutting competencies. So I think we're all much more aware of that now and trying to make that more part of our curriculum. Does that make sense?
At NYU, there's been a big initiative. We call ourselves the Global Network University now, to give people who are interested in global health the opportunity to actually do global work before they graduate. So there's a lot of ways at NYU that you can actually go abroad and do different kinds of things. We have a number of study abroad courses. The M.P.H program offers courses in Brazil, Geneva, London, Mexico, South Africa. NYU has 14 global fully staffed global academic centers around the world, and we have 2 portal campuses, one in Abu Dhabi and one in Shanghai. So if for people who are interested in global health, we think it's really important that you have an opportunity to get into the field and do something abroad before you graduate, and we've put a lot of resources in place to help you do that.
I'll just add a little bit to that. And again, what the keynote speaker was saying, and that we grapple with in our program. In fact, we're just redoing our culminating experience as a seminar now, precisely to grapple basically with the conflicts and challenges that Dr. Solomon was discussing. So how do you approach upstream and downstream factors simultaneously? In other words, the analogy that we like to use is there's a dangerous river and you're frantically pulling people out one by one from the dangerous river, but many people are getting through and drowning. So you can stay there and keep pulling, or you get someone else there to keep pulling, but someone needs to go upstream and see why people are falling in the river. So it's that very complicated sort of, how do you balance all that in an environment of chronically limited funding? And so because we're a very applied program, and that's one of the advantages, and I've heard that reflected in the other panelists, of having working professionals in the program. They're bringing those like 21st century challenges right out there from the field right into the program. And then we grapple with them right there and then adjust our skills and our cross-cutting competencies to make sure that we are training right out our door students and alumni to continue in the work they're already doing and balancing things like upstream, downstream, and how to collaborate across different fields, which we really can't have, as Dr. Solomon was saying, these solutions that are really working on a powerful impact on a global level without having professionals and understanding how to work with professionals from all sorts of different professions.
Just one last thing. So I think one of the challenges of public health is that if it's successful, no one really knows what it is, right? If we're doing a good job, then no one thinks about public health. And part of the challenge and benefit of that is it's really interdisciplinary, so it's hard to identify what public health is. And at UC Berkeley, besides having lots of cross-disciplinary degrees, you can also take classes at any of the other schools that Berkeley has. So at the Haas School of Business, at the Bolt School of Law, at the School of Environmental Design and City Planning. And it's really, really encouraged to not stick within the School of Public Health and to take those classes, because the only way you're going to be a successful public health practitioner is to have those networks and those resources and understand how really successful fields like business and law do the things they do and how that translates into public health. So that's one of the things that I think a lot of our programs have to offer, is that cross-disciplinary education.
Okay, so our next question is for Ms. Gayle. Does your school look favorably upon students whose ultimate goal is to go to med school?
That's interesting. I guess I can say yes to that. I certainly will elaborate. We do see, kind of as I was referring to earlier, students from a lot of different backgrounds. And some of those, academic backgrounds. So some of those students will have started off on the pre-med track, and it just might not have worked out at the time, or something might have come up, or their interests might have been redirected for a short time, such that they're now applying to our M.P.H program. It's typically the pure M.P.H that I see students who may be headed off to med school applying for that program. So yes, we like to see that, because I think that they have a nice understanding of the sciences, although that's not, all of the areas that are helpful in contributing to your success as a public health student. But then they do go off from our program to possibly apply to med school. It may not happen because they, again, may get redirected into staying in the field of public health. And as I mentioned earlier, we actually have an MD, M.P.H at Tufts, so some students may kind of go that route. And then I mentioned earlier too, we have the special master's program, the Master in Biomedical Sciences, which that is a one-year program, same exact curriculum as the first year of medical school. And classic, another combined degree program that we do have that I didn't mention earlier, you can do an M.P.H with that. So there's a lot of ways for students who are interested in medicine, medical school, to follow that public health route. And I love that because there's so many different ways for you to enter and to wiggle your way through there and to get to your final goal. So we love seeing pre-med students kind of come through the public health area and then seeing what they do from there.
I'd like to add something if I could. I think, yes, an MPH and an MD are, those skills are incredibly powerful and you will have a huge impact. But when you're applying to public health programs, you're kind of walking a fine line, although you might be using the public health degree as a stepping stone to medical school, and there's nothing wrong with that. In your public health application, you might want to mention, of course, that you're interested in medicine eventually, but you want to really focus your application on your interest in public health and not concentrate so much on the medical side of things, because we want to know why you're going to be a great public health practitioner and then how you want to incorporate that into your career with medicine. But, you know, as you're preparing your application and medicine is something you're thinking about down the line, just be careful in how you handle that in your application.
Thank you. So the next question is for the whole panel. So what is the primary trait you look for in a public health school candidate, academics aside?
The primary what?
Your primary trait, characteristic trait.
Trait.
Oh, sorry.
Besides academics, right, Elvin?
Sorry?
Not focusing on academics.
Yeah,
in
not
addition to
academics.
Okay, so I think the biggest component besides academics, well, we really look at the application holistically, but I would say that as a School of Public Health, we value having work experience. Most of our students come with a few years of work experience before they enter our school, and I think that enriches the classroom experience, because a lot of, at least when I was in school, what I learned the most from was from my peers, because they had been out and doing the work and they brought that back into the classroom. And it helps you get what you want out of your education, because you know what skills you have and you know what skills you don't have, and you go back to the classroom with kind of a goal. So I would say that work experience, whether it's paid, volunteer, full-time, part-time, it doesn't have to be, you know, for a public health organization, but any kind of work experience is really, really important. And will make you a competitive applicant.
And I think it's been identified across the panel, but I think it's really important, just to reiterate what the last panelist was mentioning about really having an understanding about what public health is. So many students do decide that they want to use the M.P.H as a stepping stone, but it's really, really important, if that is the case, to really understand why it is you want to have public health as your sort of your foundation or the stepping stone that you're using it for. We have a lot of students that come in and say, I want to get a master's in public health so I can be a better clinician, but really not having a real understanding about what public health is. So really do your research, understand what it is that public health is going to do to accentuate you as a professional in the future, regardless of whether or not you want to maintain your work experience as a public health professional, or you want to open the doors and actually be more of a dual career person. So understanding what public health is super important.
And I would second that, or probably how many are us? Yeah, sixth that. And then also the work experience in our program. So what is public health, and then also the work experience. But then in addition, and this would be true for each one of us, is demonstrating fit with our particular program. So I used to teach composition. So this means really doing your research about our program. from all the resources available to you. And in our case, that's the website, of course. In addition, if you're local, I conduct information sessions that approach what is public health, what is community health education, and what is the lens and the emphasis of our program, as well as the nitty-gritty of admissions. So I'll have information about it at our table. But beyond, so you've done your research about our program, and then you reflect on yourself and your interests in the public health field and your career goals, and you match it. So you demonstrate to us in your statement of purpose and in your references and in the work that you've done that truly you are a fit for community health, a small, intimate, collaborative learning, cohorted community health education program that is focused on the ecological framework and the social determinants of health, and that you demonstrate an understanding of that, and that's where you're headed in your career, and that's why you need us.
Just I'll keep it going down the line here. So again, kind of just dovetailing off what my three ladies to my right have said.
We should turn these around, right?
Two-sided. So the work experience component. So we kind of were talking about it individually coming down the line, but I think when you bring everybody's work experience as a whole together in your public health community, in your program that you are studying at whatever school you're attending, that really adds to the richness that's in the classroom, and I think that's really going to add to what you get out of the program. So at Tufts, we have in our pure M.P.H program, average age is 27, so not everybody is coming right out of undergrad. I love that some people who are in their 50s are coming back to get a public health degree, because just their path has taken them that way, and they have been out in the workforce for quite some time and are able to bring that work experience with them into the classroom for you to benefit from. So I think that's an important piece too that is helpful to you all in your education.
Okay, so now that we've all gone in a line, right? I mean,
We should start at this end next time.
that's the four ladies to my right have indicated. I mean, at NYU, I think, work experience is probably not the most important part of the application. I think the essay counts for a lot with us. Your ability to articulate, an understanding of what we do at NYU, how we do it, and how you think you fit in with that is really, really important. We're open to the idea of people coming straight from their undergraduate, which I think is an important point, because some, at least what I hear, maybe it's not true on this panel, but some programs are less, less open to people who have are just finishing their undergraduate degrees as they're applying. That's okay with us if the person has can show evidence of academic success and is able to articulate a meaningful reason why they want to be at a place like NYU. So I think it's about fit for us. And I guess about fit, I would just add too that I think there's very little substitute, or almost there is no substitute for actually visiting a place. And if at all possible, we encourage students to visit at NYU. I'm sure all of my colleagues here probably encourage people to visit their institutions too. I realize it's all the way across the country, but if you do come out and want to visit Columbia and NYU and Tufts, make a whole swing through Boston and GW and DC, and you can sit in on classes and you can meet current students and you can meet faculty. I think there's very little substitute for actually talking with people in the program and spending time there.
And ditto, I guess. Focus and fit, I think, are really important at Columbia. And you find that oftentimes through work or volunteer experience or personal experience, the courses that you took in school or a book that you read. But when you apply, you really need to show us that you're ready, again, that you understand our program and where you want to go. It is really about focus and fit. And as Zach was saying, I think it's important to visit if you can. I didn't mention this before, but outside of the tri-state area, New York, Connecticut, and New Jersey, our next biggest feeder state for schools is California. We have a lot of students coming from California. I don't know why you would want to leave this weather, but yeah, so if you ever find yourself in New York City, or just on the East Coast, you can certainly make a trip up and down I-95.
Thank you. So that's the end of our questions. If our attendees in the crowd have any questions, we would like to open the floor to you guys. Yes.
My question is to the whole panel. Does your school provide facilities
want to start for once?
Oh, we're starting at my end. Yes, we do have a great administration with a lot of support opportunities for all of our students. You know, we want to make sure that you're comfortable and that you're succeeding. So we have all kinds of tutorials and counseling sessions and things of that nature to make everyone feel at home. New York can be kind of intimidating, and the schools sometimes, it can get a little busy and a little overwhelming. So we do provide resources for folks. If you feel like you're kind of treading water and need some help, we're there for you,
So we're going in a line?
I guess.
The question was about was it about underrepresented
Oh, I'm
students?
sorry.
No, I didn't hear the whole question.
I should have
Was it-
repeated it.
Was it about underrepresented students? Is that what
Supports.
support services. Well, I mean, yeah, you know what, as Betsey said, you know, graduate school can be a shock to a system. I mean, it's very different. It's very different from undergraduate life, and depending on what kind of institution you came from and what kind of institution you're going to, it can be a real shock. For instance, going from a small liberal arts college to a place like either Columbia or NYU. I think could be jarring to someone, and so we too have a lot of support services in place for you know, wellness and academic support services. And I'd say also that the student community itself is a vital source. There are tons of affinity groups and clubs and different kinds of organizations based on all kinds of, you know, affinities that students can take advantage of, and I think they can really work to mitigate some of that. And you know, I think any good university or college has a full range of these kinds of support services and is concerned about the things you're thinking of.
So my answer, I have to say, is a little bit similar to my colleagues to my left. And in our medical school, we also have a dean of multicultural affairs as well. So not only are there the kind of business type services available, like we have a student advisory and health administration. You know, we've got the yoga, we've got the counseling, all of that. We have a learning specialist, academic resources. You know, if with students with disabilities, if they need assistance with that, we certainly are able to provide those. And then we also have a lot of the social activities that would be there for the students who are looking for that aspect of support as well from their peers. And there's a lot of programming that goes into effect for that. And since our Medford campus is so close by, about 6 miles. A lot of events are happening across campuses, which I think is really nice too, because that allows students to have a whole other student community available to them as well, and other resources as well.
And again, ditto. But in the larger university at San Francisco State is an incredibly diverse university that's set up with robust systems for all sorts of students, underrepresented students, and all sorts of students coming in, international students with every type of diversity and background. So we're just, you know, that's where we are. It's who we are. It's our mission. So on the larger university, yes, you'll find all sorts of official programs. In addition, because that's our mission, the students, as my fellow panelists are saying, the students across campus have formed their own organizations for various different groups of students who, you know, with affinity to form a community. So there's that at the wider campus. In addition, our program, because it's so small and intimate, and because it's largely populated with underrepresented students, we're our own little organization. And our graduate student group is extremely, like I said, active and very much in terms of a support community, not just among students, but among faculty and alumni as well. In addition, we have individual faculty advisors assigned to each student who comes in, who follow that student through the entire program. I also serve as an advisor for students across both cohorts. And so the idea is nobody is lost in the shuffle. And so what the needs are brought, and students are encouraged to initiate, I need this, this need isn't being met. And then we work together one-on-one with the student and as a faculty community and a student and faculty community in joint governance to address on an individual and community basis the needs.
So shall we beat the dead horse? Okay.
It's not dead.
It's not dead
vibrant
yet.
and
I'll agree
vital.
with what everyone says, and in addition to sort of the institutional support, learning specialists, academic support, you know, career advising, academic advising, We also, the institution itself does have a strong support for these student groups that are self-formed by our students. And the great thing about graduate school is because most of us are over, we're adults. So I think students are really capable of sort of pulling these resources together, and the institution does support those efforts. So I think that's something that students are really excited about, and there is support at the university level as well as at the program levels for all of those different opportunities for students.
I'm so glad you asked that question. So as I had mentioned before, social justice and health disparity is really a focus of UC Berkeley, and we have an entire office of diversity services that's just for the School of Public Health. So that includes the director of diversity, and that includes myself as well as other people. And pretty much the mission of our office is to help with the recruitment and the retention of underrepresented students into the School of Public Health, and then the successful entry, matriculation, and graduation of those students. So a couple of the things that we do besides advising and workshops, we do a summer preparatory seminar. So once you are accepted into the program and you start, you've already accepted before you start school, the week before, we have a week-long seminar that is jam-packed with things that we think will make your transition into grad school easier. So that includes like workshops, it includes appointments with faculty members, it includes career services, guides, campus tours, everything that we think that you might need to kind of help start your transition at UC Berkeley. And I think the biggest thing, and we just had our seminar in August, that students gain from that is they get a really tight cohort of 30 other or 29 other students that are starting with them, that are going to be looking at those same kinds of issues, because we have a kind of application process for the seminar, and they're across all the disciplines, so you form a really tight-knit cohort that goes with you your entire 2 years and afterwards. And we want to facilitate that kind of community, and that's one of the ways that we do that. We also have student clubs, multicultural health student organizations, a lot of community-based projects that really work with communities who are underrepresented in higher education, but our entire office is dedicated to that mission.
Okay, so we have time for one more question. Yes.
This is for anyone who wants to answer. It does not have to go up and down the line. But my question is, at the M.P.H level, how important is it to apply to a program as a specific faculty member, researching in your area of interest, versus finding an overall program that you're interested in?
I think at the master's level, I don't know what we're going to do, but at Columbia with the master's, it's not as important. If you were applying to a doctoral program, I would say it would be very important. But for master's, I think you're really looking more at the department, your focus. If you have found a faculty member with whom you'd like to work at the master's level, nothing wrong with that, but it's not, as important as it would be as a doctoral applicant.
I would actually say that it depends on what you want to do too. A lot of people want to do research even at the master's level, whether it's like community-based participatory research or something like that. And so if you know that your ultimate goal is research, having a faculty member at whatever school that can do that is really important. And a lot of people look at Berkeley to see if they have faculty, and I think that's a smart decision.
And I would expand on that, and not just in the research area, but the teaching area as well. So it's really, I think it's a great idea, and I think it's an important part of determining fit for a various program, of who you're really excited about being around and being mentored by and working with. So for example, in our program, there were a tremendous number of opportunities to work either for units, and in some cases with grant funded, for pay for either as research assistants or teaching assistants for a wide range of our faculty across the health education department and holistic health, because we have a holistic health program. So I think it makes tremendous sense to look at the biographies of the faculty along with all the other dimensions of the program, and just like we're lining up ducks in a row, you're lining up ducks in a row and deciding on your best fit.
All right, this is the end of the second admissions panel. Let's give a round of applause to our admissions panelists.